What I think is important to remember about harm reduction is that it takes time to change. And myself, I'm an overdose survivor. There's been multiple near-death overdoses that I've had. And if the Narcan wasn't available, I would have never had a chance for recovery. And a lot of people aren't gonna get into recovery their first attempt. I mean, a lot of times it's gonna take a number of attempts to get into recovery. And then so it's really important to stay safe along the way, whether that's a needle exchange so that you don't get hepatitis or HIV, or if it's keeping Narcan on your person so that you can be saved if you have an overdose. I think it's really important that you have to stay safe even throughout your addiction so that you do have a chance to recover.
There's multiple pathways to recovery, and people don't typically stop using substances, become completely abstinent, and life is perfect after that. There's ups and downs along the way, and one of the models that are out there helping people right now is harm reduction. And it's just a way that people can start making those changes in their life while they're getting the assistance of medicated assistant treatment or whatever pathway they're choosing. But while they're on that, they start to make those major changes that will help them the rest of their life. So harm reduction is a model where it's not complete abstinence, that sometimes a person chooses to use drug replacement therapy, or a popular one right now is Suboxone, but they're stopping the use of heroin and fentanyl, that seems to be in every drug right now, that's killing off our population. So instead of using the fentanyl, they're using a substance that's helping them maintain, it's reducing the cravings, and then it also helps them to start repairing their relationships with their family, helps them to become employable and have a job, and is also saving their life from using the more dangerous drugs.
I'm a family medicine, addiction medicine physician, and since 2005, I've been taking care of substance use disorder and general medicine patients in northern Michigan. And I have a private practice in Traverse City. Harm reduction refers to the goal of reducing risk and keeping someone alive is the general principle. You don't want to make things so restrictive that you don't just allow for progress. You're not searching for perfection. And total abstinence is not the goal.
Okay, so I started my treatment of patients with substance use disorder when I started treating pregnant women. I work in the largest OB practice in northern Michigan, and when we had moms that came in pregnant and using substances, I wanted to make sure that they could get the treatment that they needed so that they could take best care of their new babies. Harm reduction allows them to use a substance in a way that is less likely to cause long-term effects. So some of the things like Narcan that you'll hear about, if someone feels that they have an opiate, they're using opiates and they feel like they don't have a problem, but maybe they get an opiate that is stronger than they're used to and they overdose. A Narcan allows them to come back, and that chance, that bringing them back to life allows them the opportunity to get into treatment and allows them the opportunity to get healthy and to stop using. Or for example, needles. If someone is sharing needles, they're more likely to get a communicable disease, which is more likely to be communicated to other people, their spouses, family members, other substance users. And if they're allowed to have needles that aren't potentially harboring disease, then they're able to not pass on diseases to other people. So they may continue to use, but they're not harming themselves as much or their community. So one of the things that happens if you overdose on opiates is you don't have a respiratory drive and you can stop breathing. Narcan reverses that. You can actually, right across from the courthouse, there's a box where you can just open up and get a kit to use, and that shows you how to do it. You use it nasally. There's also, you can go to the health departments, they have them. You can ask your doctor for a prescription for Narcan and they can send that in for you. And harm reduction is a great program that we have in Northern Michigan, Harm Reduction Northern Michigan, and they can get you Narcan as well.
Okay, so in front of our tattoo shop, we've coordinated with Harm Reduction Michigan to have Narcan dispenser in front of our tattoo shop. And we unload a lot of Narcan into the community that way. And we've got their resources available in our tattoo shop as well. Harm Reduction Michigan is pretty known around this area as a place to go, as a pathway to recovery.
My proudest moments is opening my tattoo shop. My family, we got married right around the same time, me and my wife, and that was a really proud moment too. When my family came out for the wedding, they were able to see the shop, see Manistee. They had never been here before, you know, and I love this area and it's just amazing. So it was good being able to show them that stuff and show them how far I've came, you know.
Everyone should have some Narcan in their first aid kit. You never know what's going to happen with someone. Maybe they got a prescription from their doctor for a knee surgery and they end up overdosing. Having that in their kit can save a life. Or you could have a situation where a child got into a prescribed narcotic and the Narcan could save a life. So it's something everyone should have in their emergency kit.
So I've been in what's called a recovery coach, peer prevention specialist, and so my role is bringing people in to recovery, people who don't realize that there's treatments available and options to get well. And so I'm kind of a navigator, resource broker, we call ourselves. Harm reduction, that's a great conversation. Harm reduction to me, personally, has many forms and many faces and many shapes. Harm reduction is lowering use if it's alcohol, to me. Harm reduction can be someone using Suboxone or methadone in a clinically supervised setting to reduce the use of like injectables with a needle. Harm reduction can also mean entering into a treatment court program, mental health court, DUI court, veterans court, or youth court for the youth offenders. Harm reduction can be supervised through a probation also as well. Harm reduction can also mean simply a self-proclaimed abstinence where you're actually spontaneous recovery, they call that. That's harm reduction to me. I think for me personally, it's important because you do, no matter what, and if you're a real strong street user of illicit drugs, harm reduction can also begin that pathway where we're changing our behaviors, where we're learning it's okay to reach out and ask for help from the professional world. And you don't have to just all of a sudden be abstinent from whatever it is you're using as an escape to realize that through harm reduction, recovery can be possible.
Staying in recovery, you really have an opportunity to build on the dreams that you threw away in your addiction. I had a lot of dreams that I had that when I was using heroin and when I was using other drugs, I pretty much gave away all of the dreams that I had as a child. And when I finally stopped using those substances, I was able to revisit some of those things that I had hoped for my life, but they were really unrealistic goals because I was trapped in a cycle of addiction. And so I just think it's important to know that dreams can come true, that the things that you had given up on, there can be other opportunities to get those back. And those opportunities can come in different forms that you might not even know are available.